Dan and Don coming to you from The Clinical Trials Guru. Again, that website is www.theclinicaltrialsguru.com. And how are you? Today, Dan and I want to discuss, is expanding your business to multiple sites more advantageous financially for a research site? Or is it more financially advantageous just to expand your space that you're currently in and build from there?
Yeah, so obviously this video is for the people working in the industry, people working in the industry, specifically the business development people or the people in charge of overall strategy for their companies. And this applies to the research sites. So it's an excellent question. I don't think there is a right or wrong answer. I know at South Coast we have 3 sites, so we've started from 1. We expanded to 2 more. I think it's up to the owners and the staff as to their comfort levels. Some people are okay with expanding nationally. Some people are okay with expanding globally. What I choose to do is to expand locally in our area, in our region. And we started with psych. We're starting to branch out into neurology. And I'd like to expand that way by bringing in more doctors with different therapeutic specialties. Like we're going to be doing an arthritis study soon, a couple pain studies, some hypertension studies, in addition to what our bread and butter is, and which is psychiatry. But we're expanding by expanding our product lines, not necessarily opening new sites.
Because I think some sites are probably looking at the idea, and this is just a guesstimation on my part, is that let's say I got 3 sites and I want to open up 3 more, so they give me 6 sites or 7 sites or 8 sites or whatever, then I can duplicate that one study across all those sites, which will increase my income by that much more. But the other thing you have to think about too, if I'm running expenses at a certain level at that first site, am I going to run the same expense for that study at the other sites? And those are some of the things you have to think about. If you're at one site and you want to grow your space to bring on other indicated studies, can you do it that way instead of just duplicating each study at all these different sites? Can you just bring in more different studies that might pay about the same and not really have to increase your staff by that much? So as Dan said, it's all up to the individual. I think there are probably different business models you can approach it with. I'm guessing the key thing is you just have to look at financially what's going to be most profitable for you.
Yeah, and don't ignore using your business intuition to determine whether opening another clinic is actually the right thing to do. Because we didn't open our 3rd clinic. Actually, we didn't open our 2nd clinic until we were guaranteed a study.
Exactly.
We didn't open our 3rd clinic till we were guaranteed another study there.
Right.
So if you're just going to open a clinic and spend money on staff and start worrying about where you're going to hang up the clock and what color your walls are going to be, and you don't have a study, guess what? You're going to have a fancy office, and you're going to be paying for it every single day with no revenue coming in.
Absolutely. That's not a good move. You want to make sure that you have a study to put in that site. When you open up the doors for the first day, you should be ready to start a study right at that moment.
Oh, and you can even hire an interior decorator. It doesn't matter. You need to get studies.
Yeah.
You need to test the market and see if there is demand for that, and just start selling. It's all about sales, and
It is.
What I mean by sales is getting more studies.
It's all about getting more studies. And again, I think both of those are different models. It all depends on what your goal is as far as expanding, because I've seen both done, and I've seen them both successful, and I've seen both done and both not successful, because business is always should be based on your own common sense in that market. But anyway, just food for thought from Dan and Don.
You do the dishes. Another thing I wanted to mention, we talked about this yesterday. This industry, the clinical trial space, especially from the research clinic level, it seems like once you get established, you can get away with a lot that you couldn't get away with in other businesses. Like, you don't necessarily have to be as aggressive with your marketing once you're established. You don't necessarily have to worry about customer service like, let's say, a restaurant would, because you don't have that much competition. So you can get away with a lot and get carried away thinking that you're an excellent business person, but really you're just getting lucky in an industry that favors you once you're established. But don't think that you can replicate that as easily by cutting corners, because you're gonna learn the hard way.
People services are important. You got to give good service to people when they walk in the door. I don't care what type of clientele you're dealing with. People will know who's treating them the right way, and that's going to make a difference too on your success. You might get away with it for a while, but after a while you'll find that your patient population start drying up, because you'll start getting a reputation for being a place that no one wants to come to.
So if you're a research clinic, if you're someone running a research clinic and in charge of overall growth, call us up. We want to interview you and ask you what your experiences are, your thoughts are, and maybe you can just help other people or just get some free promotion for yourself. But we'd be very interested to interview you guys.
Absolutely. So I think we're going to cut it short there.
Yeah, Dan and Don signing off from theclinicaltrialsguru.com. Thanks a lot.
Thank you.